Setting: Zenith University, Nigeria, where science meets inquiry. In the heart of Zenith University, Dr. Emeka, a celebrated epidemiologist, walked into the research hall, scanning the faces of ambitious graduate students. Among them stood Ada, a final-year student ready to embark on the most critical journey of her academic life, her dissertation on infectious diseases. But research wasn't merely data collection, it was an intricate dance, from case reports to systematic reviews. Phase 1. Case reports. The first clue. Ada's first encounter with research came through a case report describing a rare malaria strain in a rural clinic. Case reports are anecdotal, offering early observations but lacking broader applicability. Best practice: ensure details are precise and ethically reported. Pitfall: case reports cannot establish causation, only patterns. Phase 2. Cross-sectional and cohort studies, observing populations. With guidance from Dr. Obiora, Ada expanded her work into a cross-sectional study, surveying infection rates among 500 villagers. Cross-sectional studies capture data at one point in time, while cohort studies follow subjects over time, tracking health changes. Best practice: use validated questionnaires and structured surveys. Pitfall: confounding variables can distort associations. Phase 3. Case control studies, investigating risk factors. Diving deeper, Ada designed a case control study, comparing infected patients with healthy individuals to identify risk factors. These studies provide stronger evidence but rely on past data, which may be biased. Best practice: carefully match cases with controls for accuracy. Pitfall: recall bias. Subjects may misreport past exposures. Phase 4. Randomized controlled trials, the gold standard. Wanting strong causal evidence, Ada designed a RCT, testing a new malaria treatment. Patients were randomly assigned to treatment or placebo groups, eliminating bias. Best practice: ensure strict blinding and ethical drug testing. Pitfall: RCTs are costly and require long-term monitoring. Phase 5. Systematic reviews and meta-analysis summarizing truth. To solidify her findings, Ada conducted a systematic review analyzing global studies. Meta-analysis followed, statistically combining results for the highest level of evidence. Best practice: use databases like PubMed and Cochrane for quality studies. Publication bias. Best practices for focus group discussions and key informant interviews following correct guidelines. When conducting focus group discussions, FGDs, and key informant interviews, in qualitative research, adhering to the consolidated criteria for reporting qualitative research guidelines ensures rigor, transparency, and validity. Focus group discussion. Best practices. Participant selection. Ensure diverse yet relevant participants. Aim for 6 to 10 per group. Facilitation. Use trained moderator.
Now that you have watched the local Nigerian tale, let's dive into the theory. If you haven't seen the story yet, I strongly recommend you do so, as it will prepare you for the lecture on levels of evidence. Before we delve deeper, let's clarify some facts and definitions to ensure we're all on the same page. 1. You need to be able to clearly define what research is. 2. It's important to understand the various categories of research. This is a common exam question, so be aware that there are more classifications than those you have studied. Make sure you understand qualitative studies, the different types of clinical trials, as well as systematic reviews and meta-analyses. Don't forget to revisit this video before your main exams. Trust me, you'll want to because it's packed with information you're likely to see on your test. Make it a part of your study routine. 3. Take the time to thoroughly understand the different components of your research projects. Let's go, guys.
Hello, dear. I am your research methods tutor. I will take you through the slides, but more importantly, I will let you go through each of them. To help you focus, please do the following. 1. pause or reduce the speed of each slide to read the contents. 2. Make sure to be able to define what research according to 45 CFR 46.102. During your exams, you will encounter multiple times questions on research design types. It is important you pause the slides to view these. 4. For your coming school project, be familiar with the usual contents and what it is expected in each of them. 5. During your tests, you will encounter the levels of evidence. Be sure to know which of these is the highest and the lowest. 6. You may be asked to state the level of evidence of your school project cross-sectional study. 7. You may be asked to list the different methods of collecting a qualitative data. These are not included.
Friend, research is good. Look at these black guys. They are just like you and me. They just think and it happens. Boom. See, there are numerous benefits of doing research, from contributing to or generating new knowledge to implementing research that improves our health and our environment. You know, these great guys make our world a better place for all of us, and I know you agree they do. So, why not become one of them? Yes, why not? This is not just a lecture or a combination of tales, stories, and visuals, but a journey to discovering who you really are. A lot of great guys in the medical schools in the country focus narrowly on the patient and what the books say. But few go beyond and outside the box to challenge the status quo. Be that few? Man, look around you. There are local pointers to what you could do to make Nigeria, Africa, and the world better. Everything you need is here. Be another black inventor. Why not join a research club today? Discover something today.